Namaskar everyone. My name is Dr. Manish Yadav, and now today we are again going to go on a journey of understanding Burnett's cases. Today I'm going to talk about a very interesting case. In fact, this the subtitle of this chapter he has written is an interesting case. And I was wondering, when I read the first title, that what is interesting. In fact, I feel every case of Burnette is very interesting, especially when you go in deeper sense and try to find out his thinking process, the way he's thinking about the remedies, the disease process. It's all interesting. So what's more in this case and why he has purposely written as an interesting case? But yes, after I completed the study, and it took me a long time because there were a lot of things which I got, some really good nuggets I got, which opened some of my cases, some of my stuck cases. I got a thinking process how to go about it. So I'm really excited to share with you this. I hope people who are listening to me right now, if you are a first time who are listening to me, I would urge that please go and watch my introductory videos of Burnett, because once you watch those videos, then what I'm talking in this lecture is going to make sense a lot. If you watch directly this lecture, I don't know how much you're going to grasp it, because whatever I'm speaking, the basis of it, I'm not going to go into the basic of it, because already I have already spoken about it in my previous lectures. So even if you watch it, I would urge that please go back and listen to those lectures, because Burnett has completely revolutionized my practice. Understanding Burnett and understanding Hahnemann, especially the later part of Hahnemann's thinking process, has helped me so much. I can't tell you, I can't tell you the wisdom that I have got. And in last few years, the way my practice has evolved, so much satisfaction I have, I just can't tell you. So the purpose of coming on the podium is to share these things with the world so that somebody gets the benefit. So directly, let's start the case. So let me share the case first with you. Again, it's a case of a uterine fibroid. A few more uterine fibroid cases already you have seen, the management of it. And this is an interesting case. Chapter number 18 from Burnett's tumors. April 10th, 1883. Patient came, an unmarried lady, 51 years of female. Since 8 years, being suffering from uterine tumor with occasional bleeding. Tumor was hard as a board. Patient also had a fatty tumor, that is a lipoma, on the left clavicle region. Here, a size of an orange. She was anemic and washed out looking. Now, what is washed out looking? It is an old English term. Washed out looking, the literal meaning is that exhausted and tired. Especially when you see a person who's very exhausted and tired, maybe this is because of the anemia. So that was the look and the constitution, physical constitution of the patient. Past history, I hope till now you have understood the importance of understanding the past histories, because his prescriptions, especially for nosodes, the zoic medicines, was completely based on understanding the soil from which the disease erupts, the past and the family history. So mother died of consumption, that is tuberculosis. So what do we find here? We find here that she's a lady of uterine tumor, fatty tumor. So there's a tumor, basically, kind of a benign tumor that's already there. Anemia is already there. And patient has got consumption in the past. So let me make you understand beforehand, only before we go ahead. I will step by step explain you. But looking at this, what do we understand? See, looking at this, I've also many places talked about Allen's miasm. There's a wonderful book that people should read. And Allen's miasm, there's a lecture on miasm, Sora, psychosis, and syphilis, which is there in the same YouTube channel. You should go and watch it. You'll get a lot of understanding, a simple understanding how to catch this miasm. So if you want to catch the fundamental cause, the miasmatic cause, what is it? So if you look at here, tumor, uterine tumor, fatty tumor, generally tumor, uterus, pelvic region, pelvic region and urinary tract region, especially these regions are there, it is psychotic in nature. This is a stint of psychosis. Okay. Anemia. Allen says that anemia is a very important component of psychosis. In fact, in today's world, 80% of our cases are psychotic. Then we go down. What is the family history? Tuberculosis. What is tuberculosis? Tuberculosis is actually a mixture of sora and syphilis. So one side is sora, one side is syphilis. So in this case, you can find it is a tri-miasmatic case. Actually, if you think there is psychosis in the disease form, and there is a mixture of, there's a soil of sora, which is always there, and also a tinge of syphilis. So now when he's going to approach the case, so one is to give on the totality of symptom, present predominant, and whenever he has to go back or other symptoms are not there and he wants to intervene with an intercurrent, he will mostly look for giving antisorics, anti-syphilitic drugs, and ultimately giving the psychotic. Hahnemann in his Rima Hadley's book, if you read, and especially chronic disease, if you read, he says that, especially chronic disease, he has given like tri-miasmatic case is there, and you are confused like what should be done. So he says you have to first kill sora, you have to give antisorics repeatedly, again and again, again and again. So antisorics, then comes syphilitic, and then comes, basically your psychosis or whichever is predominant. But first has to be antisoric. And he says you have to keep on giving it repeatedly. And I was so happy listening to this case because exactly what Hahnemann said in his chronic disease, Burnette did in this case. I have a strong feeling that what Hahnemann did in his later part of his life, I think Burnette was one of the person who actually understood it, and he really took it to next level through his clinical case. So let's go. Continue. Now, the most prominent subjective symptom was like, so patient when comes, so we talked about the fundamental cause that we will address, but when patient comes to you, he will always give you some present predominant totality. What is happening to him or her right now? So one of the subjective symptoms that she gave was blown out feeling. What is this? Blown out feeling means feeling of swelling all over body. Patient will come and tell you, I feel like my body is bloated. My legs are bloated. I feel swelling everywhere. It's like, you push air in a balloon. It's blown out, blown out. सूज गया है ना हिंदी से सूज गया है बहुत सूजन है बहुत सूजन and when you touch the patient you find no edema, you find no dropsy, the clinical one, no pitting, nothing is there, but patient will come and keep talking to about blown out feeling, blown out feeling, blown out feeling. Now this is actually the sensation, the very important sensation, and you have to find out the remedy out of that. Objectively she was anemic and her gait was waddling. So I seized hold onto this available point. The blown outness means a feeling of being bloated, enlarged, grown in a way, a sensation basically. And the remedy is Bovista. So we'll read Bovista. And Bovista he gave. I have used Bovista after reading Burnette, how Burnette used Bovista in many of his cases on this sensation of bloatedness. I've used it, 3-4 months before also. I gave it to a female who used to keep coming to me, and she was generally getting better, but menses and everything, but general health was not better. And many times she used to come and tell me about the swelling, bloated hair, legs are bloated. And I never understood, and suddenly it clicked to me when I was reading Burnette that bloatedness equals to Bovista. And of course, other symptoms has to corroborate. And then bloatedness, Bovista was given. Let us read from Boric and Clark. So in this session, what we are going to do is that slowly and steadily, as we go ahead, we will keep reading from our textbook. Okay. So let me open Bovista and let us see what is written in Bovista. First, we'll open boric. Okay. It has great marked effect on skin, eczema, circulation, adapted to stammering children. Now, stammering children means basically stammering is a part of nervous phenomena. So you'll find Bovista a very good skin remedy. Hemorrhage is also there. Urticaria, it's a very good remedy for that. But along with that, you'll find that Bovista has got a great action on nerves. So you'll find gait problem. It will come in next some few lines. There is a problem with gait. There is awkwardness. Like apes, they will catch hold and they will drop it. Stammering, they cannot use the right words. So nervous phenomena is also there. Then we come to the mind. I have spoken about this thing in many of my lectures, and I will tell you again that when you read Materia Medica, when you are looking for a remedy in Materia Medica, like suppose you want to give Bovista, what do you have to match? Like what we need to match is that, like suppose you want to give Pulsatilla, any remedy, whatever patient says has to be written in bold or italics or underline or at least in one sentence in your Materia Medica books. Unless you find that it is not written, whatever on the basis, forget about the repertory. You have repertory, that's okay. Suppose it is there in a repertory, it's there in repertory, but it is not there in Materia Medica, then you will never give it, never give it. I'll just give you an example. 3-4 days before, I got a call and I was looking for it was an acute case. The patient said that she feels better lying on the left side. Okay, a lot of abdomen pain and diarrhea was there. I went down in a BBCR and I looked. I think it is natrum sulph. Natrum sulph was there, the remedy. But I opened boric. Let me see what is written in boric. I'll show you. Now I'm talking about another case, just to trying to make a point here. Okay. So when you see natrum sulph, the patient said that she feels better by lying on the left side. And it was a very nice symptom. Okay. But I opened this and see what is written here. It is written worse lying on the left side. Our patient says better lying on the left side, and it is written in repertory also. But in Materia Medica, it is written left side aggravates lying on. So whom should I depend on? If you ask me, I will depend on Materia Medica. And of course, other features. If you look at the bolds, there has to be flatulence, loose morning stool, great size fecal matter. So first I will look for the bolds and the italics. That genius has to match to the symptom. So in the same way, when we read Bovista is a syphilitic remedy. You know that. Syphilitic remedy, night aggravation is there. And last sensation. In the mind, when you see it is written in bold, other remedy is argentum nitricum. And last sensation in the mind means patient feels that the body is enlarged, body is dropsical, body is swollen from inside, body is bloated. This is the sensation. It's a feeling. Means if a patient with ascites comes to you and says, I feel bloated, that's a clinical symptom. Pitting edema patient comes and tells you, that's a common symptom. But there are no clinical dropsies. There are no clinical edema. No disease, but patient comes and tells you, I have a feeling that I feel enlarged, I feel swollen, I feel bloated. That is this meaning of this symptom. So characteristic symptoms are those which are not common. So which can be found in disease state, but like intussusception is there, or there is a peristaltic obstruction is there. Then you have a lot of other symptoms, common symptoms. But when there are no obstruction, but the patient talks about as if he has got all the symptoms of obstruction of intestine, and those symptoms become important and the remedy indicated should be given. I hope you understand that. The next is awkwardness. Everything falls from the hand. This is what I was saying. Awkwardness. They cannot pick up the things. Things fall. The nervous phenomena is very much. Then we go down. Head. Head is also sensation. My head is enlarging. A stammering. We already spoke about, right? And okay. Let's open Clark. So Boric and Clark and Allen's, these are few books that I always refer to. Again, corresponding to the signature is bloatedness, puffy condition of the body surface, a sense of enlargement, flatulent distension, noisy passage of flatus. These are the leading features of Bovista pathology. Okay. And you can see ovarian cysts. Okay. A lot of things are there. Let me go down. Let's open female. Yeah, we are here. Catamania premature and too copious. Catamania flow only in the night. Night aggravation signifies syphilis. Another very important feature of menses, which I have given Bovista on this, is very important thing is during menses what happens. So before catamania is menses, diarrhea. Diarrhea during and before menses is a keynote symptom of Bovista. So I will always look for that, and henceforth it goes forward. So he gave Bovista. Let's see what happens next. She says she has apparently menstruated. After giving the remedy, menstruation started. Does not feel anything like so much blown out in the abdomen. Her feet, which had been much swelled for some time past, were considerably easier. She felt better. Repeat Bovista. So that's a general rule. If the patient is doing better, you either repeat, you increase the potency, or you wait and watch. On the whole, not any further diminution, there is some hemorrhage. So now, next follow-up, status quo, some hemorrhage is there. And here he gives lapis alba. Why lapis alba? Lapis alba, I think there's a lecture on chapter number 13, where I have talked about lapis alba, the indications of lapis alba. Now see, Burnette had lot many remedies. He was a person who was impressed by Rademacherian approach and Paracelsus, then Rademacherian. So organopathy was very important for him. He always used to think about the sphere of action, which area, which organ it is affected. So when it comes to uterus, there are few remedies which you will know as we go ahead. There are few remedies for him which was very important. And he used to give it as an organopathic drug. Lapis alba is one of them. And also why lapis alba here? Because lapis alba and calcula flow. Lapis alba and calcula flow. The difference is that lapis alba tumors are very soft and spongy. Calcula floor is very hard, okay, like stone, like conaya. This patient, along with the tumor, if you remember, he also had a lipoma, on the left-hand side. And lipoma is what? Fatty tissue, very soft tissue. So that was one of the indication which I think organopathically he gave. And even the uterus, the indication of lapis alba in uterus, I will request you to go and read chapter number 30. So the idea was to give an organopathic drug. So once the patient comes with some, characteristic symptom, totality remedy is given. Once that has done its work, now the work comes is about addressing the organ, hitting the organ right. Better. After lapis, better, smaller in the body, like tumor feels little smaller. Can now eat vegetables. Now vegetables she can eat. No vaginal discharge. It says repeat lapis alba. Well in herself, but size of tumor is not less. So it is again status quo. Complaints of flushes and fullness in the head. Now here, that's the only symptom. No other new symptoms are coming. Okay, because homeopaths can prescribe only when the symptom totality comes. There's no other symptom coming. These are localized flushes are coming. That's it. And as I told you in the beginning, fundamental cause. So whenever there is a status quo, or when your right remedy is not working, these two conditions. One, there's a status quo, or your right remedy, you think it is not working. No other symptoms are erupting. That is the right time to intervene with the anti-miasmatic remedies. So what he will do here, he has to give an anti-miasmatic remedy. So what do you suggest? Like which anti-miasmatic he should give? So according to Hahnemann, in tri-miasmatic cases, first kill the psora, first address psora. So anti-psoric has to be given. Now, when you look at here, flushes. Now, flushes means that in Allen's keynote, when you read sulfur, it is written localized congestion. Means you will find in the patient, the lips are red, cheek is red, one part is red, hot generally. So localized, one part is hot. So here we find congestion, flushes. That is also a part of inflammatory process or SORA, basically. So I was thinking to give sulfur, but actually he gave sorinum. Why he gave sorinum? He must be having his own understanding about sorinum. He must have seen the symptoms. I cannot comment right now. But yes, how to give sorinum? It's very simple. Everything sulfur, but chilly patient. So you want to give in sulfur as an anti-soric, but the patient is very chilly. You cannot give sulfur, right? Then you have to think of other antisorics, the general antisorics. One is heparsulf and sorinum. Sorinum is very deep acting remedy as along with sulfur. So it ties with sulfur many times and you can use it. There's a tendency of quinsy, appetite problem, right? In the night they feel hungry, feels well before the attack. All those some characteristic symptoms are there, which you will get definitely in the patient. So he gives antisoric sorinum, and you will see as we go ahead, in between he will keep repeating antisorics again and again, and especially sorinum he choose. So he will keep repeating sorinum again and again. Next, what happens? Worse, larger, very uncomfortable in the body. Her eyes swollen, urine scanty, feet are swelling. Now, what happened? Is it a good sign or is it a bad sign? Many times when you give antisoric, deep miasmatic remedy, or any antisoric, psychotic, or anti-miasmatic remedy, generally the vital force which is lying down in the lethargy gets excited, and then symptoms it starts throwing. Means the remedy goes inside and stir it, and symptoms start flowing. That's what we want. When symptoms and the discomfort will come, we are guided by signs and symptoms. So once they will start coming, then we can form a totality and give a remedy. That's one of the rules. Now here he gives platinum mure. To my surprise, I said, why platinum mure? And he starts his dose. Let us read platinum mure. And first what we'll do is that, first we'll go ahead and read platinum mure from boric, actually. So the idea of reading Burnette is not just to go through the cases, but also learning the remedies, because the real essence is actually remedy. So let's open platina mure. Okay. Now keep in the mind, okay, what you have to keep in the mind is, he's now thinking of a fundamental cause. So what are the fundamental cause? He has to address SORA. He has to address psychosis. He has to also address syphilis. So now, generally it goes SORA, then syphilitic, then psychotic. Generally, it is like that. Because I might have said, earlier when I spoke, I was speaking very fast, so I might have said that SORA, psychosis, and syphilis. But ideally, it is SORA, address, then think about syphilitic, and then go to psychosis. Because psychosis is a very slow, steady process. Remember, if somebody has psychosis, it is not going to kill the patient. It's going to remain dormant. And psychosis means it's going to take a lot of time. Slowly it progresses, slowly it will go. So too much changes of remedy, fastly you want to cure it, it does not happen. It should not be done, because that can harm the patient. It's like if you have a car, if your car which has got 20 ka speed, or a bike which has got like 40 speed, and you want to run it on 80 speed, what will happen? It will run. But ultimately, there will be a brake fail, there will be a damage. That's how psychoses are. So we'll talk about psychosis some other time. So now he's thinking about what? He's thinking about a syphilitic remedy which has got uterus involvement. And let's go to platinum metallicum. Let's open that. And first we'll read the relationship and see what is written here. Platinum mure. It is written in platinum metallicum in relationship boric. Platinum muriaticum. This remedy has achieved a beneficial results after iodine of potash failed to cure syphilitic affection. What is iodine of potash? Iodine of potash is Kali iode. What is Kali iode? Kali iode is a syphilitic remedy. Kali and iodine, when you combine it, it is an anti-tubercular remedy also. It's a lot of tuberculosis is there in that, and very syphilitic remedy. It's somewhere it is written obstinate chronicity, means a chronic complaint which develops slowly, but syphilitic. So when Kali iode fails, platinum mure maybe is a good remedy. So he gives platinum mure, and of course he might have seen some more things also. Violent occipital headache, dysphagia, syphilitic throat, bone affection, caries. Okay. Then you can see the next remedy that is written is platinum mure natronatum. We'll talk about platinum mure natronatum some other time. Let's go to Clark and let's see what he has written here. So, okay, let's go down. There are some very good cases. When you read Clark, the utility of Clark is that he will give you some references of cases. And here he has given Nash cured a case of insanity of some duration with platina mure. Okay, that's what I'm thinking. What is happening? Sorry. I just opened platinum only. Platinum mure. Yeah, that's how I got confused. Okay, now we are there. Chloride of platinum. Also remember this, if you think from a other understanding is that platina and mure. So platina like quality, platina is a syphilitic remedy, basically, and female remedy. And you see muraticums. So mure component is very important. So now, like if I have to prescribe mure, now I know mure in other terms also, like mure is like natrum mure. So natrum mure has got reservedness, craving for salt, and all the other components of halogen. So those also I will try to see. Brooding is very important part of muraticums. Okay, sadness, gloominess, melancholia. These are some features. So in my practice, I will also look for these things if it comes. If I have to give platinum mu, basically. I'm just adding my points. So you can see here, it is a very good remedy for caries, syphilitic caries. Okay, nasal bone, syphilitic rheumatism, gonorrhea, also gonorrhea, condylomata, gastric carcinoma and acne, even gastric carcinomas. And very important point to prescribe. Of course, see, now we are trying to decode Burnett's understanding. But from that, we also have to learn and understand that if I have to practice or prescribe, I can't just give empirically, okay, because a tumor comes and I will give platinum mule. Why? Because Burnette had given. No, this is a wrong approach. We are always, my dear friends, guided by signs and symptoms. So in our practice, there has to be some symptoms. So platinum mule, when you read, it's not a well-proved remedy, but there's a very important mind symptom. What is that mind symptom? Poison. Thinks he has been poisoned. So when you put poison in search in Kent's repertory, you'll find out other remedies. There are rubrics like delusion, he has been poisoned. Delusion thinks he's being poisoned. Delusion people will poison. Like that. He will be killed. So plumbum is one of the remedy. Lacasis is the remedy. Hyoscyamus is the remedy. And along with that, platinum mure is also one of the remedies. Now, it is very important that, okay, let me show you one symptom, okay? Let us put poison. Now, this is also very interesting. When you put poison in the search and you just look at the mind symptoms of Kent repertory, all these remedies you can see. This rubric, delusion, poison, thought he has been poisoned. Semisifoga, hyoscyamus, and platinum mure. Now, hyoscyamus we all know hyoscyamus for being poisoned. Semisifoga is also ecteresymosa, sadness, and all those things are there. Platinum mure is a rare remedy, I feel, because it is not well-proved remedy. So the idea is what? This I learned in my practice, that in especially Kent repertory, if you're searching for a rubric, suppose you're looking for a rubric, in that rubric, there are remedies polycrest remedies, but suddenly you find out a remedy which is not well proved, whose data are less. Your ears should stand out, your senses should become alert. What I will do is that I will first go and read that remedy, and many times that remedy is there. Like suppose xanthosellum comes somewhere, oxalic acid comes somewhere in my very important rubric which I am searching. My purpose of looking into the rubric is never rubric. I never give a remedy to a patient because that rubric match the patient. No, the remedies in the rubric is very important. I can leave the rubric, the remedies I take ahead. So when you focus on the remedy and try to match the remedy, not the rubrics, there's a different shift in your practice, different shift. Okay. Let's open platinum mute. So this very important symptom of being poisoned. Then we go to females. Okay, there's not much thing given here. It's given. Violent itching in the glands, diffuse sensation of warmth, itch, sticking, some symptoms of acute inflammation of urethra, pain on urinating, slight dysuria. What do we find here? We also find, okay, I'm just reading the male sexual organ parts, but I'm just trying to make a point here. You can find a lot of pelvic uteric regions, or sorry, in this male, if we talk about the sexual organs are being affected. I told you before also that whenever renal area and the sexual organs, either male or female, are affected, it says that it is psychosis. There's a psychosis in the background. Our patient also has psychosis in his background. Platinum mute, though we are saying, book says that it is syphilitic, predominantly syphilitic, but also, I hope you studied this, that it is written, it is a good remedy for gonorrhea also, and rheumatism, syphilitic in a way. So it also has got tinge of psychosis in it. There are many remedies, we say that it is syphilitic. For example, Merck salt is syphilitic, that's okay. But combination of Merck salt, when you look at Merck core, it's a very good psychotic remedy. Gonorrhea, psychosis, kidney trouble. It's a wonderful remedy in kidney failures. So don't get your mind stuck that, this is that. No, it could be predominantly that remedy, but the combination of it, when you go platinum mute, platinum ars, platinum sulf, read the literature and you'll find out the tinge of other miasms also in that. Okay. Let's get back to the case. So you can also go and look in the Grimmer, Clark. Let's go back. What happens? In January, patient comes, next follow-up, has lost palpitation. The fibroid is smaller in size, but the lipoma is larger and she has no appetite. So yes, the remedy did something was better. He again intervenes with Sorinum. Why Sorinum? Antisoric. If you remember, I told you, in the past, I told you that Sora has to be, keep on giving in between, antisorics has to be given. Pain in the chest gone, fearful metrorrhagia, and here he gives verulinum. Generally, in the data that is given in the case, the indication of verulinum is not given, but verulinum is a very good nosode. Why it is given? Where there is a past history of smallpox. So when we have past history of smallpox, like measles, we give MMR. When past history of smallpox is there, then he gives. So he might have seen somewhere in the past or in his data, which is missed, not written here, but that's how the Zoic remedy is given. So he intervened with verulinum. And this you will find out in many of his cases, that he will go back and trace the past cases. On the basis of the past cases, he will address it with a nosode. Looks cachectic, lipoma is much larger. He gives calciraflor. I don't know why he gave calciraflor. Because, see, I'm not here to justify all his remedies, right? I'm just trying to decode his cases. I feel because once he is giving lepis alba, and calciraflor is contrary, because lepis alba is a soft tumor, calciraflor is a hard tumor. So generally, maybe this was an empirical prescription. And we also do many times. There are many times I have seen some of my cases, long follow-up, In between a time comes when we just give some remedy, thinking of something. But follow-up, that's why understanding follow-up. Follow-up will tell you whether you are right or wrong. And see what happened? No better. Feet is swollen and has much rheumatism. So this remedy is just not affected. In fact, it has caused aggravation. Not aggravation though, but disease is aggravated. Now rheumatism is covering. Feet is swelling. You can see the signs of rheumatism, generally psychotic. When you find a lot of osteoarthritis, joint problems in the past. So psychotic miasm is predominating slowly and slowly. So this is what is layer by layer treatment. So once you remove the layer of psora, you keep hitting the psora because psora is everywhere. It is the deepest miasm. Then slowly, syphilitic things, you give some syphilitic remedies, antisyphilitics. And slowly, layer by layer, patient will start showing you other miasms symptom. So now rheumatism is coming up. What I would have done here, we will go ahead and see what he has done. I would have directly given Tuja, Medorinum, especially I would have given Medorinum here because of female, areas affected. We'll talk about Medorinum in the last part. Or Tuja, nitric acid, I would have thought of. Or I would have just thought of psychotic remedy. Is always worse in spring. Let's see what he does. Unfortunate lady's side is truly fried. So the size is increased. And now he gives aurum mur natronatum. Now aurum mur natronatum. What is aurum mur natronatum? Aurum mur natronatum is a very good remedy. In fact, what happens after that? We'll talk about this first. There is much discharge per vagina, but it is more watery. She can walk better. Her feet are less swelled. Heart beats uncomfortably. And there is a well-pronounced murmur, based heart on the arm. Best heard at the base. No doubt, hemic nature. Anemia. So that's why he's saying that heart is involved. The palpitation is there. But the cause of this palpitation is anemia or hemic nature. She has cough, distressing pain somewhere in the part of abdomen. He repeats aurum. So aurum mur natronatum is one of the remedies which really did good in this case. Now, why he gave aurum mur natronatum? General idea, if I want to tell you, the first thing was he's continuously thinking of a syphilitic trait. He wants to kill the syphilitic trait. Hence, the pathology also has to match. So platinum mur was also given on that basis, organopathically. First, he gave lapis alba. To some extent, it did little better. But he was searching for a remedy which was syphilitic and uterus is affected. So platinum mur, very close. Some mur element he must have seen. And then platinum mur, which did fairly well, not some great. But see, step by step, he's moving. He's also trying with different remedies and trying to see which one can affect. And slowly and steadily, aurum mur natronatum. So aurum is a gold, which is deep acting remedy. Uterus, syphilitic. Whenever syphilitic remedies we think about, the first remedy that we think about is aurum. And then natrum, aurum mur natronatum. So natrum component, muriatic component, because in platinum mur, I told you the mur component was there. So that's how we thought about. But let's read aurum mur natronatum from Borick, Clark and Anschulz. We'll read also from Anschulz. As I told you, now the idea is to enhance our understanding of the drugs. What Burnette had to do, he has done and he has gone. But now we are in the field, so we have to understand the remedies. And we have to give remedies not empirically. We don't have to give no source empirically. It has to be given based on science, signs and symptoms properly. For that, we need to understand it properly. So, aurum mur natronatum. First thing, what is written here? This remedy has most pronounced effect on the female organs, and most of its clinical application has based thereupon, has more power over uterine troubles, tumors, other than any other remedy, and quote Burnette. So it was Burnette who discovered this remedy. He used this remedy and he quoted that this is a remedy, syphilitic and uterine trouble. So if you have got uterine fibroid, uterine tumors, and you find in the background syphilis, aurum mur natronatum is one of the wonderful remedy which Burnette has used in many places. high blood pressure, psoriasis. Okay, let's go ahead. Female, let's read female. Induration of cervix, palpitation of young girls. Now, just strange, right? Palpitation of young girls. What does this suggest? Aurum also has got a very good action on heart. So heart, like gold remedies, are very good for heart. So heart affection is very important sphere of action of aurum. Coldness in abdomen, chronic metritis, prolapse, uterus fills up whole pelvis. Can you imagine? The uterus fills up, the tumor becomes so big that in the X-ray you will find out, so whole pelvis is being affected. That's that much swelling can come. So when you have a tumor like that, the remedy that you can think of is one of them is aurum unat. Along with that, ulceration in the neck of womb, vagina, leukorrhea, ovary is also indurated. So it's also a very good remedy for induration of ovary, ovarian dropsies. So your PCODs, polycystic ovaries, ovarian affection, a great remedy. Similar like medurinum, when you read Allen's keynote, it is written all types of inflammation like ovaritis, salpingitis, Bupharitis, everything, all inflammation of pelvic region, medurinum is the remedy. But medurinum generally has a psychotic base and it's more of inflammatory origin. Here, what we are talking about, there are ulcerations. It is more damaging. It is syphilitic, right? Syphilitic is very destructive and damaging. Subinvolution. What is subinvolution? The uterus swells and then it doesn't come back to its original position. That is subinvolution, especially like in pregnancy. Pregnancy, the child is there, uterus swells to incapacitate the child, and when the child goes out, the normal uterus has to come back. But there are uterus which does not come back. It remains like that. Huge. So huge size of the uterus. That is subinvolution. This is a sphere of action, an ossified uterus. This is a sphere of action of aurum unat. When you read Clark, double chloride of gold and sodium. You can see carcinoma, ascites. Okay, you can go back. Okay. Bony pains, boring pains very marked in this pathology of salt over eye, skull, chest, tibia, bones. October to spring headache. If you remember, somewhere it was written spring aggravation. This lady, this patient that we're talking about. So even the modalities, warts on the tongue. Now there are remedies, with you can give just looking at the warts. Wart on the tip of the nose, wart on the ear lobes, wart on the chest, wart on the neck, wart on the back, wart on the penis, genitalia, scrotum, legs, shin, wart on the tongue. Very rarely you will find this. But if you find that wart on the tongue, the first thing is that you go and look for the remedy and try to match out. Kidney diseases, syphilitic origin. Enormous induration of ovaries. He says it is, he could have just said induration of ovaries. He says enormous. So same with uterus, subinvolution. Uterus fills up the size of pelvis. What they're trying to say, the tumor, the growth is very big, very big. Induration of one part and softening of another part of uterus. Corrosive leukorrhea, and it's also very good remedy. As we know, it's a tumor remedy. So carcinoma of breast, how can you miss it? So uterus is also affected and also carcinoma of breast. So now, how do I think is that you can think of this remedy in ladies who come to you with CA breast. And in the past evolution, when you go in the past history and try to find out the evolution, you find out that the lady also had uterine trouble. The lady had uterine trouble. This uterine trouble was there, fibroid was there, or tumor was there, which was operated. Maybe, total hysterectomy was done. And few years after that, carcinoma breast came in. So in the same patient, both the areas are affected. Aurum unat is a very good remedy. Old cases of rheumatism and gout. Now again, rheumatism. You see here, this patient also has started getting rheumatism. So a lot of things are matching here. Causation, jaundice. So when you say jaundice is a causation, in Clark Mathematics is also very good because it narrates the causation. So in that lady, so now you have a lady who has got hysterectomy, you go back and you find out that she also had multiple times jaundice. So jaundice can also become a cause of the disease. That is why it is so important to go back and trace all the illnesses, all the surgeries, all the symptoms that have come in the past. Because when you go in the past and study the evolution of the disease in the patient, I tell you, it is so interesting, so interesting. Just on the basis of those, you can prescribe it. And that is the utility of understanding Burnette and miasms of Hahnemann. Unschuls. I want to show you Unschuls basically. So this we are doing Clark. Okay, the same things are here. Pustules on genital. Abortions from induration of uterus. So amazing. This is, you will find ladies who come to you that they will say, multiple abortions happened, frequent abortions happened, and the cause is big size of uterus. In sonography, you'll find out size of uterus is big. There's induration, or there are tumors or fibroids in the uterus because of which abortions are happening. This is syphilitic in nature. And here autoimmune natriuretic can save. And see the next line, what is written. Even to syphilitic mothers, it prevents the diseases of her offspring, cirrhosis of uterus or mammae. So if you got a lady who has got syphilitic tent, there is uterus or mammae is enlarged, and you've got history of it. You give mother, when she's pregnant, you give her, the offspring that are coming will be not troubled with the diseases of, the child. Many times the infant comes out and then a lot of diseases comes in. Of course, vaccination is one of the part of it. But yes, a lot of diseases come in. How, like one child comes and he's healthy, one child comes and he's always ill. There could be environmental factors and other things, but the past, the genetic, the hereditary tendencies is one of the causes. So how wonderful it is given. So if you have a patient, like, pregnancy lady is coming, or you have a lady who's got under your treatment and then she got pregnant, please give her, since you give autoimmune natriuretic with all those histories if available, it can help the offsprings from many, many multiple diseases. One more book is there, Anschul's New Remedies. I'm not going to talk about it completely, but I'm just showing you. Please read that Anschul's book. What beautifully he talks about autoimmune natriuretic. Because when you read from multiple books, your understanding of the drug increases. That's how your application of the drugs also increases. We keep giving the same polycrest remedies. You know why? Because we know only that much. We never read because we are so much used to repertory. Everything we want to repertorize, but we never read mathematics. And to be really if you really want to have a brilliant cures and manage these difficult cases, you have to go back and read Mathemedica, the drugs from different sources, what different authors have talked about it. So autoimmune natriuretic, when you read, wonderful explanation he has given. And the best part is he has cited cases. I love reading cases, the cured cases, because you learn so much from these cases. Chronic metritis, induration of uterus, hysterical spasm, induration of cervix, chronic metritis, antiversion with prolapse. These are the cases that he has solved. Okay, and then female uterine disease. So these are the cases that Anschulz has shown. I'm not going to read it because it's going to take time. It's a homework for you. Go open Anschulz and read autoimmune natriuretic. You get such a beautiful understanding of that. And I really know that in today's scenario, there are a lot of patients who need autoimmune natriuretic, and you can really help them with this remedy if you have a better understanding of it. So let's go ahead. Now we reached till autoimmune natriuretic. What happens now? Gouty inflammation of the right foot and ankle, vaginal discharge has ceased. Is smaller, certainly. So tumor is smaller, discharges have ceased, but gouty inflammation of right foot and ankle is coming. Now, what is happening here? Just to make you understand, rheumatism is coming, other things are coming. Right foot, the joints are getting affected. So fundamentally, the fundamental cause, psora, is being addressed. Syphilitic continuously is addressing, but there's one thing which is not yet addressed. And you know what is it? Psychosis. Let us see when he is going to address. So these are the features of psychosis. He repeats as the patient was doing better. Foot, ankle, well, except that ankle bone still ache. The tumor is much smaller so that the patient is relatively comfortable. Old brown discoloration of skin over the forehead is nearly gone. She's rather restless at night. Fatty tumor remains same. So he repeats, why restless in the night? Again, syphilitic manifestation is there. Slight vaginal discharge as if the monthly period, but it continued for 3 weeks. Size of tumor about the same. Lipoma is trifle larger. He again intervenes with Surina. I don't know. I'm waiting for psychosis fatigue. Hanuman said, keep repeating Sora in between. No bleeding, less comfortable, uncomfortable. Soles of the feet tender and painful. And now he gives urea. Now this again a remedy is so wonderful. Urea, let us understand. After urea, tumor a good deal smaller, patient is healthier and is greatly improved. So you see, he gave auramune natrium. It was working, and a time came when it stopped working. That's how you have to think of some other remedy. Because every range of action, I've explained this in range of action. You want to walk 20 miles. You get a friend who says, I will walk 5 miles. You drop him there. Then you take another friend, another companion, get to the next mile, 5 mile, 5 mile, 5 mile. That's how you complete your 20-mile journey. So auramune natrium had that much sphere of range of action. He did it. Now it's gone. So now you have to think something else. So urea. After giving urea, tumor of good deal, smaller, patient is healthy, greatly improved. So now urea also did good better. Again, he intervenes with Sora because antisoric he wants to keep giving it. Did a much good, no bleeding, tumor is diminishing. As urea was affecting, see, ideally, I wouldn't have given Sora here. Sometime I feel Burnette frequently keeps prescribing. We have to get, I feel personally, in my practice, I don't change the remedy so often. I will give time for the patient, but that's okay. So he gives urea. Now, understanding urea, as I told you, learning Burnette, seeing Burnette, the entire cases are not given. Very small data of information is given. The idea is to know more remedy. When you read Burnette tumors, basically your idea of remedies increases and the new way of understanding remedies come in. Urea, when is urea given? Low specific gravity. Blood, when you do urine investigation, you get pus cells, electrolytes, so many other things are there. There is one more component where specific gravity is there. And in many cases, it is seen that low specific gravity, high specific gravity. What is low specific gravity? Low specific gravity in urine suggests that urine is too much diluted. The person may be drinking too much fluid and have a condition that makes them thirsty. Condition that cause low specific gravity means what happens is that urine has a lot of substance, right? A lot of components, substance in urine. That's why it is heavier. But a time comes when a lot of urine is there, means it is over diluted. Then the specific gravity reduces. What are the conditions? One is a diabetes. When a patient is diabetic, because he has to urine continuously, he feels thirsty, keeps drinking water. Second is damage to the kidneys or kidney failure, especially when there is a damage to kidney failure. Kidney damage is there, tubules are, damaged. Then filtration does not happen. The substances get collected there and urine just keeps on passing without the toxins getting out. That's how specific gravity also becomes low. Damage to kidney tubule cells and renal tubercular necrosis. Generally, it is seen that, renal tubular necrosis happens, and generally, not in every case, but generally you will find out that past history of tuberculosis or tubercular background, generally you will find kidney damage. In kidney damage patients, renal cases, if you go back, you will find out tuberculosis is one of the component. So you have to be very, very careful with this. Drinking too much water, low sodium levels. Now let's read urea from Boric and Clark. Okay, let me open urea. As I told you, right? How wonderfully he sees, na? See, what he is doing is that, what is he doing? He's giving the remedies, but he's like an allopath he's like a pathologist, looking at all the organs. Okay, heart is affected, kidney is affected, uterus is affected, ovary is affected, and continuously is thinking from pathological point of view. Somewhere very nicely he has written that A homeopath first has to become a pathologist. If you become a good pathologist, means you are aware of the organs which are being affected, the clinical signs, the investigations, you know where the damage is going, where the disease is moving now. You can be a very good prescriber now. So now kidney is being affected. Okay, he knows from the urine, kidney is being affected. This patient was not having diabetes. So definitely there is a damage in the kidney tubules. And then in the past, there is, what is there? There is tuberculosis also there. So that's how we connect. So he wants to find out a remedy which is tubercular in nature and which has got low specific gravity. And urea is one of the remedies. The first word in the boric is written tuberculosis. The first word. So background, you will find tuberculosis. Enlarged glands, renal dropsies, okay, albuminuria, diabetes, uremia, all those things are there. Clot. You can see albuminuria, diabetes, eczema, gout. Failure of kidney to eliminate urea from the blood leads to uremic intoxication, delirium, and convulsion and coma. On general indication, urea has been used in medicines by both schools. Allen cites two cases, renal dropsy, when symptoms of general intoxication in which urea divided 3 doses cured brilliantly. So especially in cases of kidney failures, this is one of the drugs. When you find in the urine, the specific gravity is getting lower and lower, and you find collection of urea and the toxins in the blood. Maybe urea is one of the remedy that can be used intercurrently. Burnette has used urea and uric acid in gout. In fact, urea and uric acid, both the remedies have got gout in the trouble. So now rheumatism is coming in this patient. So it's also a very good remedy for rheumatism. When the gout, especially gout, when gouty eczema has been the cutaneous outlet for the constitution. He says, like a patient comes to you, he's got gout and then he gets, or he's got rheumatism and then he gets eczema. So what is happening? The gout is expressing itself cutaneously. Uric acid, urea should be the remedy you should think about. Burnette gave urea in gouty cases when urine was thin and low specific. So when you have urine problem like low specific gravity is very low, you think of urea, or you think of later you think of uric acid. It thickens the urine and gives relief, great relief to the patient. So when the problem in the body is because the toxins are not able to be flushed out, you give urea, he says that it will thicken the urine, means the passage of the toxins, the urea and other substances will start happening. And once it will start happening, the body will get relaxed and the symptoms will come down. The toxicity symptoms will come down. He relates a case of tuberculosis cured with it. That's all. That much. You read other books, because if I just keep talking about the remedy, it will take a lot of. My idea here, friends, is to give you just a general view at that how the remedies has to be read, and looking at the pathophysiology also, looking at the blood investigation reports also, we can connect and we can think about. Like suppose a patient comes and you find out that in her case, since 10 years, always her potassium is being affected. Question should come in your mind, why only potassium is being affected? Maybe you go and read Kali salts. Maybe you can get the remedy of this patient. Okay, I'm just giving you one secret or maybe a nugget, basically. So investigation, pathology has to be understood very nicely and then correlated with the drugs in our remedy. No bleeding at all, much smaller. She's quite, just a minute. What is there? She is quite losing her cachectic look. Lipoma is no smaller, it's same. I don't think you should worry about lipoma. I just don't treat lipomas. If it is more and extensively growing, that's okay. Having a fatty tissue. There are some tumors now we should not be disturbed, I feel. One of them is lipoma. Has another attack of gouty inflammation in the feet. He gives lapis alba. That's okay. Has grown much larger. Is not so well in herself. Some leukorrhea. Cannot rest in night. Goes to sleep for 2 or 3 hours. Wakes up, remains awake, restless, cannot. He again repeats. urea, still large, tumor is still large. Again, he gives antisoric. Now, urea he used just as an intercurrent in, just like, you're going for a travel and then suddenly you are hungry, but you don't have something. So you just take help of something. You eat some snack or something like that. So these are small remedies which help you to a small distance, or in some small blockages are there, it helps you to remove that. Then again, you have to come back to the bigger remedies. Again, Sora. Why Sora? Antisoric. Okay. I'm still waiting for my psychotic to come. He has still not addressed psychotic. I think that was a missing part here. But let's see how it goes. And now what happens? Much inflammation in the eyelid. Tumor is distinctly larger. And now he gives Medorine. This is what I was waiting. Exactly this is what Hahnemann said. When trimasmatic case, you give Sora, address Sora, syphilis, psychosis. Whichever way, but Sora, syphilis, psychosis, or Sora, psychotic, syphilis, whichever is prominent, you have to address all the three one by one and keep repeating the sequence again and again. That's what Hahnemann says in his miasm, chronic disease. And Sora is so inbuilt. So Sora has to be given again and again. That is why I think he kept on giving it again and again, antisoric. But yes, now the time came when he understood that, my God, I have done everything. I have addressed all the fundamental cause, but only one fundamental cause is not addressed. That is psychosis. And whenever it is uterus, ovaries, pelvic area, out of all psychotic remedies, Medorinum is one of the best remedies. Please go and read Medorinum from Allen's and Boring. What happens? Did her so much good that she has had no medicine since. She now comes to us if she needs any more. And that's how the case went off. So after Medorinum, actually she got better. The tumor has gone down so much that the patient has become shapely like any other lady. Still gets occasional periods, as nearly as I can judge. And tumor is about 2/3 gone. But the fatty tumor remains. Okay, that's no problem. He again repeats Medorinum 30. Tumor again much diminished in size. No bleeding, no discharge. There is still some rheumatism, left conjunctivitis. See, even conjunctivitis. Generally, conjunctivitis is also psychotic in nature. Why? Neonatal ophthalmia, especially when the child passes through the birth canal, and if the lady is psychotically, affected, the first affection is in the eyes. So, eyes, anemia, rheumatism, okay, urogenital organ, pelvic organ. When these affections are there, psychosis is in the background, my friends. Again gives urea 12. Don't ask me why, I don't know. Okay. Eyes well, rheumatism well, no discharge, not much tumor left. And then he gives Hecla lava. I have no idea why he gave Hecla lava, because generally Hecla lava is given for tumors of lower jaw. Maybe some symptoms he must have seen. Organopathically he addressed it. That's okay. And now we are at the end. So now I will just read from the book. This ends the treatment, which it will be observed began in 1883 and terminated in 1886. 3 years, continuously 3 years, in complete cure of tumor and restoration of patients' good health. I am pleased to be able to add 5 years afterwards, 91. I am pleased to be able to add that though I have not seen this lady since June 86, she sent me a word in July 81 that she had had no return of a tumor of the womb and continued in capital health. The occasion of this message was sent by her friend, blah, blah, blah. Ladies, okay. And since then, no tumor, no tumor. So patient got cured, 3 years of treatment. I think so. It was an interesting thing. What do you think? Please comment on that. It was really interesting because it opened so many channels for me to think about in a case. And I was just so happy to read the drugs. It motivated me to read these drugs. Urea, I wouldn't have ever understood how urea works, when to give urea. Even aurum natrinatum, the way I understood after reading this case, it has increased my understanding. But yes, I'm again going to go back and read from Mater Medica, all the drugs. Also, it shows the importance of fundamental cause, chronic miasm, everything, right? Everything. So I'm done with here, my friends. Thank you for being a patient listener, and write in the comments if there's any question. I hope this helps you in your practice and you become clinically very sound and help. Many humans are, human beings are suffering. Homeopathy is a great science. If you do proper homeopathy diligently, classically, taking help of these stalwarts, their mindset, their understanding, we can do some great work, and great human suffering can be relieved by the way we practice homeopathy. Thank you very much. Namaste.